My name is Tim Brewerton, and I am a professor emeritus of psychiatry and behavioral sciences at the Medical University of South Carolina, where I have spent most of my career. I've been here since 1987, where I started the first eating disorder program. I came here from NIMH, where I did research training on the role of serotonin in eating disorders, and I've been focused on eating disorders and related conditions for most of my career. I got interested in trauma very early on in my career after I met my first case of multiple personality disorder in 1988. And then I started looking at the research on eating disorders and trauma, and there wasn't a whole lot then. In fact, it said that there was no relationship between eating disorders and trauma, and that did not really coincide with my clinical observations. So I started doing research with the National Crime Victims Center, and we established that, in fact, histories of rape and molestation and physical assault were very common in people with eating disorders. And we established that in the National Women's Study. And so the role of trauma and PTSD, as well as substance use disorders, has been a focus of mine for many, many years now. And I have remained at the Medical University of South Carolina, but I've consulted with a lot of different people and collaborators and eating disorder organizations over the course of my career. And it's really been a pleasure to be associated with SunCloud Health over the last few years. There are very few places in this country and in the world that have embraced food addiction, even though it's really been established as a reliable and valid concept or entity. And there have been literally over 5,200 articles published in PubMed over the last several years, increasing every year on this phenomena. So it's an area of intense interest and of intense relevance to what we do. Of course, it's all about improving patient care. It's all about helping people who suffer from eating disorders and substance use disorders, which overlap in themselves.